Hey everybody, Dr. Colleen Cira here. I'm a licensed clinical psychologist and the founder and executive director of Cira Center for Behavioral Health. Welcome. Thanks for being with me today. Coming on with an intensely personal video that I hope you'll really be able to see yourself in and that we can maybe all learn something at the end of it. So I'm not at my best today. Because I am going in for a diagnostic breast ultrasound because my last breast MRI a week ago or something, it showed that there were lymph nodes that were enlarged and, irregular in shape. And so they're worried that I have breast cancer. For those of you who follow me, you know that I'm a childhood cancer survivor. I had Hodgkin's when I was 15, and the treatment, radiation in my upper torso, puts me at really high risk for breast cancer. So I rotate through mammograms, MRIs, and ultrasounds with regularity, several times a year to just get scanned. They're always scanning. They've told me it's less a matter of if and more a matter of when. Not quite that, but close. So I'm waiting to hear that I have breast cancer quite frequently, which is, an anxiety provoking position to be in. But here's the little monkey wrench. I had my second COVID shot, as you guys know, if you follow me. I had my second COVID shot, almost 2 weeks ago on Sunday. My MRI was just a couple of days after my COVID shot. So interesting that there were inflamed, enlarged lymph nodes. So I figured my arm was incredibly sore and incredibly swollen and inflamed. I figured it was probably a false positive because of the vaccine. So then obviously my parents are a little worried. They did some digging and my mom found an article from some doctor in some different state saying that women should wait a full month before having any breast imaging done after they've received the second, or maybe whatever, after they've received the vaccine, because it can look like breast cancer. Okay, all right. So some relief, floods in and that feels good. But then what happens is that the fear creeps back in, the worry creeps back in, and where I've been really stuck, where my head and my brain keeps going, is the image of sitting in the waiting room. It's a diagnostic, so I'm not going home to find results in a few days. When it's a diagnostic, they tell you that day. So I'm waiting in the waiting room, and I'm back to being 15, right? In the waiting room, where instead of the doctor coming out to say, everything's fine, well, don't worry, go home, don't worry about it, yay, everything's fine. They say, why don't you come and back with us? We'd like to talk to you. We'd like to talk to you and back. And anyone who's watched any kind of medical television or has received a scary medical diagnosis, you know what that means. It's never good news if they don't tell you in the waiting room. And that's where my brain keeps going. And this isn't rational, right? Like, I know my frontal lobe knows 99% chance that I don't have cancer, which is better odds than usual because typically I really don't know. Now I've got some really good data and evidence that this is a false positive because of the vaccine. I know that. I can get my head around that. But you know what isn't having any of that? My amygdala, back here, part of the animal brain, not nearly as sophisticated as this. All it knows is emotion. It does not know time, person, place, context. So when the fear, very real fear of cancer comes up for me, frontal lobe has a very hard time staying online and the amygdala takes over and it wants to just take me back. It wants to take me back to that moment when I was 15, right? So there's an internal struggle here that is unavoidable between my frontal lobe, which says this is fine. This is a vaccine side effect. And my amygdala that's like, red alert, danger, 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 right? Like the battle happening inside my brain is intense and it's unpleasant, right? And I've been in therapy for years, for years. There is no avoiding this moment. For trauma survivors, here's the lesson for you. For trauma survivors, when you are triggered is an overused word these days, but like there's actual triggering, right? When you are triggered, when something in your present reminds you of something traumatic in your past, your brain wants to take you back there because it is centered around your safety. And so it wants to take you back there, and it wants you to be scared, and it wants you to go into fight, flight, freeze, because it says mortal danger is present, right? Even if your frontal lobe is like, mortal danger is not present, I am fine. But trauma isn't rational. You can't talk your amygdala out of having a traumatic response. You can't. If you've ever been to basic talk therapy that is not trauma informed, trying to talk about trauma, you probably left really unsatisfied or even in worse shape because you can't talk your way out of a traumatic response. Traumatic responses don't happen in your frontal lobe where all rational talking comes from. Traumatic responses happen deep in your brain, in the animal structures of your brain, and in your nervous system, which is in your body. So trauma is not rational. You cannot talk yourself out of a traumatic response. And that will just happen. But there is hope, okay? Here's the thing. You can't talk yourself out of a traumatic response, but you can take care of your body. Let me say that again. You cannot talk yourself out of a traumatic response, but you can take care of your body. So you have a choice, okay? You can get caught up in your frontal lobe, and that is going to make you feel crazy, right? Because it's like, this isn't rational. I know I'm fine. I know this is a false positive, and why can't I get this into my head? And oh my God, I'm so crazy. Or and that is like just this terrible, negative spiraling cycle that just takes you nowhere, right? Or there is some acceptance that can come, right? There is some acceptance. And of course, there's lots of gray middle ground, right? And it's a process to get to some acceptance. But this is my inviting you to get yourself into a trauma-informed therapist, somebody who's going to work not just with your frontal lobe and your thoughts and rationality, but with your body, with your nervous system. And what you can do, if you're not there quite yet, is do things that feel good for your body. Do things that feel relaxing for your body. So for me, I should have taken a full day off. I do this all the time. It's been years of learning, and I took a half day, but I still hedged my bets and was like, it's going to be fine. This is about the vaccine. And here I am, waking up with trauma responses this morning, right? So maybe you take the day off. Maybe you take a really long hot shower or a long hot bath. Maybe you make yourself some tea. Maybe you make yourself your favorite comforting meal. Maybe you journal. Maybe you call a friend, right? Like there are so many ways to take care of your body. But trying to just talk yourself out of it is a losing battle. It will only make you feel crazy. So this is my invitation to you. Trauma is not rational. Don't try to talk yourself out of a trauma response. It's perfectly normal, given your history, to be experiencing what you're experiencing. And the best thing you can do is get yourself in to see a trauma therapist if you're not already, or take care of your body. Do things that soothe your nervous system, that make you feel good. Be mindful of your breath. Take good care of yourself. Don't wage a war with your amygdala. Something to think about.